Good afternoon, everybody. We'll get started in just a minute as we allow more attendees to join the call. All right, good afternoon, everyone. I'm Andrew Sorensen, spokesperson here at CU Boulder, an alumnus of the university. I'll be moderating today's call. Some quick housekeeping items before we get started. All attendee lines are going to be muted throughout the call. When we get to Q&A, please place your question in the Q&A function. You'll find that at the bottom of your screen. We'll do our best to get to all questions, but if we do not get to your question, you can reach us at colorado.edu/COVID-19, and COVID-19 does have a hyphen in it. And as a reminder, today's call will be recorded. This recording will be added to our COVID-19 website. On today's call, we have Provost Russell Moore, Interim Chief Operating Officer Patrick O'Rourke. Chancellor Phil DeStefano could not be with us today. He's catching up after his bout with COVID-19. He sends his gratitude for all of you joining us today. We also have Jennifer McDuffie, Associate Vice Chancellor for Health and Wellness Services, Katherine Eggert, Senior Vice Provost and Associate Vice Chancellor for Academic Planning and Assessment, J.B. Banks, Dean of Students, as well as Dan Jones, Associate Vice Chancellor for Integrity, Safety, and Compliance. I'll turn it over to Interim COO Pat O'Rourke, who will get us started today.
So thank you, Andrew, and welcome everybody. It's very nice to be able to meet with you at the beginning of the 2021 academic term and to be able to tell you what we have in store for the upcoming semester. On behalf of Chancellor DeStefano, let me say that we're excited about the semester that began last Thursday and know that it's going to be a positive experience for our students, faculty, and staff. Like many of you, we were disappointed at having to start remotely. That was a decision that we needed to make in light of the orders that were placed in effect back in December related to the levels on the COVID dial. Our community safety is paramount, and all of us are looking forward to seeing students in person and on campus when we're able to resume our in-person instruction on February 15th. As we get going, would really like to say that we've been planning for the spring semester since the early fall. We've really tried to learn from our first semester experience to shape our approach. And today I'd like to take a few moments to give you a sense of where we are and where we hope to be over the course of the upcoming semester. Our staff is working hard to be able to prepare our facilities, infrastructure, and technology to be able to carry out the teaching and research mission. We've got people who are working remotely and teaching remotely at present. We are going to keep doing that to ensure right now the safety of the community and the safety of our population. As we do return to campus, the first thing I'd like to be able to talk to you about is testing. We've really been able to expand our testing capacity over the course of the last academic term and coming into this one. We've increased our capacity and our requirements, and we're going to continue with the safety measures that we instituted last term, including daily check-ins via Buff Pass. Everybody should remember to wear your mask and your face coverings whenever you're on campus. We're also going to be doing things like continuing to have reduced density in campus buildings and social distancing in the classroom to make sure that the classroom environment remains a safe place. We were really fortunate last term that even though we had a number of cases within our community, the data that we've gathered showed the classroom environment to be a safe environment and that we weren't documenting cases of spread within the classroom. Our testing expectation for the spring is that all faculty, students, and staff with a need to be on campus during the spring semester will need to participate in the campus monitoring surveillance testing program once a week. We'll be providing more detail on that as we come back in, but participation in the monitoring program is really critical to help us avoid further public health restrictions and to make sure that we're maintaining the safety of our campus environment. The existing requirement for on-campus residents and for staff to participate in weekly testing will also continue, but we really need to have everybody who is coming to campus, whether that's faculty who are teaching, staff who are working, and students who are engaging in the educational classroom experience, to be doing that weekly testing. And it's really going to be important to keep our community safe. We're also going to be continuing our full battery of public health services that we developed last term. Not only do we have the surveillance testing that I just described, but we're going to be doing diagnostic testing for those people who the surveillance testing shows as being potentially infected with COVID. Very vigorous contact tracing and case investigation will continue to be available so that we can track that down. And faculty and staff will be referred through the monitoring program to diagnostic testing, so long as they're asymptomatic. We're also going to be supporting contact tracing as needing for those faculty and staff who get a positive diagnostic test result. We've worked with our partners over at Boulder County Public Health to be able to perform those functions in our community. And I'm really grateful for our staff in the Wardenburg Health Center who are doing that type of follow-up work to make sure that we're staying on top of what's happening in our own community. I'm also really pleased to be able to announce that we're continuing also with our testing for immediate family and household members. So for our faculty and staff, please know that you will be able to continue to bring your immediate family and household members to participate in the monitoring program. As long as we have the testing capacity to be able to do that, it's a great service that we can provide to be able to make sure that the county's testing capacity is also being used wisely. We've received lots of questions about vaccine, and I'm going to shift there next. Because of the partnerships that we've developed, Boulder County Public Health and the Colorado Department of Public Health and Environment have asked CU Boulder to partner with them on vaccine distribution to our faculty, staff, and students. And so we're in the process of doing that now. We anticipate that the campus will serve as a site where faculty, staff, and students can get vaccinated should they choose to do so. But one of the things we need to be really clear about is that the timing of when we're going to be able to administer vaccine and the availability is something that we are a distributor. We are not the allocation decisions or the prioritization decisions, and that we need to follow the state guidelines as to who's vaccinated and depend upon the vaccine supply as it gets delivered to us. We're working right now with state and county health officials on the distribution and timing. Right now, the state is prioritizing first responders and people over 70 in the first stage of what they call the 1B group. The state has indicated that because those populations are prioritized, that we need to make sure that that community is getting vaccine first. And it's only after we get to the point where we have addressed the vaccine need in that population that we'll be able to move on to different groups on campus, including other essential workers and people who are in other identified prioritizations. One of the things we know right now, though, is that most of our student body, including those who are living in congregate housing, such as residence halls, are generally considered to be part of the general public in the state's vaccine distribution plan. And as such, that most of our student population wouldn't be in the vaccine distribution plan until much later in the spring. We know this is of major interest to our community, and as we have more details both about the state's prioritization and our own availability to be able to vaccinate, we'll provide that to you. But we also want to make sure that everybody understands that we can't distribute any vaccine outside of the state guidelines. If we did so, that could result in us losing the ability to be able to serve as that type of distribution point. And we really want to be in a position where we are able to serve our own campus community with vaccine as it becomes available. Also wanted to try to provide a little bit of clarity about the state's COVID-19 dial and how that relates to campus operations. When we were approaching the fall semester, the state really didn't have its COVID dial in place, and people were looking to us to say, how does this impact your operational decisions? And what we're really trying to do is to tie what we're doing to what the state has given us as a framework. For a period of time, Boulder County, like other counties, was in level red on the COVID dial. And one of the reasons that we delayed the start to in-person instruction was to be able to give time for the disease rates in the population to be able to get back into level orange. And Boulder County now is demonstrating that. And our goal is to be able to maintain our campus operations in a way that give us the best possibility of getting through the semester without having as many changes in the dial status as possible. So this extra time that we have at the beginning of the semester is really valuable to us. As of Saturday, the data for this term is that we've completed about 405 screening tests and 125 completed diagnostic tests. Those have resulted in 14 positive PCR diagnostic test results. And we've reset all of our dashboard statistics to start again in January 2021. Our goal here is really to give you a good vision as to what's happening on the campus. And you'll see that it's reflective of our work coming into this semester. In you're interested in reviewing the fall 2020 dashboard, there's going to be a link to that as well. Ultimately, we want to be in a place where we're best supporting our population within the state public health guidelines. Level orange allows us to be able to do in-person instruction that is in a limited socially distanced format, and it also allows for smaller personal gatherings. We're going to be staying in remote status until February 15th and picking up in-person instruction on February 15th. But need to be real clear that this is something where COVID will be part of our community, and it will be part of what we have to face as we come into the spring semester. We need and expect all of our students, faculty, and staff to continue to comply with public health orders and the campus health and safety policies. We know that off-campus gatherings last year led to the increase of the spread of the disease within our community, and we had to address that. We want to avoid being in a situation where the Boulder County Public Health authorities feel like that they need to impose any stricter requirements on our 18 to 22-year-old population, and really complying with the guidelines, keeping the infection rates low, making sure that we're doing masking, social distancing, all the things that we know will help keep the campus safe, will allow us to offer the best opportunity for ongoing social activities, educational activities, and student programming throughout the semester. We really want to be able to ramp those up as the semester goes on, but that's really dependent on us managing the disease rate well within our community. So in closing, we know that this won't be completely problem-free. We're going to have to address challenges that they arise, but we're dedicated to solving these problems together, communicating with you, our faculty, staff, students, and families as we experience those challenges and reach the solutions to be able to find them. And we'll be providing you regular updates throughout the semester, including other gatherings like this one. So with that, I'll turn it over to Provost Russ Moore to be able to talk about the academic experience. And really thank you for all that you've done and your patience as we've worked towards the beginning of the spring semester.
Thank you, Pat. and I'm eager as well, eager and excited as we begin the spring semester. First, I want to single out the patience, the hard work, and resilience of our students and our faculty and staff. We've been focusing on planning out the academic experience since fall began, focusing on reviewing our successes and failures, and as Pat indicated, pinpointing lessons we can apply for the spring. We've also worked to improve the student experience. We're expanding dining opportunities for both on and off campus students, including adding additional weekend locations, more variety to the menu, and new menu options. Off-campus students, faculty, and staff may now dine at the Alfred Packard Grill and the WeatherTech Cafe. Last semester, our Division of Student Affairs offered more than 500 programs and events for our students. This semester, they are expanding popular programs like DIY nights and guided painting classes to accommodate even more students interested in participating and adding additional night and weekend programs. Our peer wellness coaches serve all students and are an incredible resource for students to get connected, involved, and to set goals. We're also aligning campus events and involving opportunities to the COVID-19 dial to make it easier for students and to engage in community activities while also following public health guidance. With regard to housing for our on-campus students, graduate student housing will remain operational as normal. Move-in begins for incoming and returning resident hall students on Sunday, February 7th, and runs through Saturday, February 13th. Move-in will be by appointment, and students were able to begin selecting their appointments last Thursday. We strongly encourage our resident hall students to select their appointment by Monday, February 1 at 8 a.m. Mountain Standard Time. New and returning resident hall students will need to complete a COVID-19 test. This can be done on their own within 5 days of moving in, or they can complete a test during their check-in process. Students are encouraged to remain at home until their residence hall move-in date or shortly before in-person classes begin. In terms of academic instruction, we will, as the Chancellor said, shift on February 15th to a mix of in-person and hybrid in-person classes and student activities and experiences. In addition, there are 2 wellness days, February 17 and March 25, in which there are no classes, but the university will remain open both days. The law school is on a different schedule. Unless the campus is required to change its mode of operations because of public health requirements, courses designated for in-person instruction will continue in that format for the entire semester. I think this will provide some stability to our in-person classes for both faculty and students. In regard to our academic operations and calendar, supervisors and department chairs will work with faculty and staff to define who should continue to work remotely based upon the needs of their units and the necessity of the campus to provide significant and meaningful in-person educational and co-curricular activities. Existing research activities, including related graduate student research, will continue in person as approved through our existing protocols. The Research and Innovation offices hold on new approvals and personnel to return to campus is extended through the month of January. I just want to again restate how grateful we are to the campus and to the Boulder communities for their partnership in managing the pandemic, and how key that partnership has been to launching our semester. Having said that, I agree with Pat that this will not be a trouble-free semester, and there may be things that defy our intentions and that will change our plans. You should know that our #1 goal is to help our students continue their academic progress. Part of that progress is, of course, exposing them to a range of ideas and viewpoints. So with that in mind, I'd like to mention 2 very engaging events that are upcoming. One is on Thursday at 7 p.m. You can register now for a timely webinar with Professors Cornell West of Harvard and Robbie George from Princeton about the state of civil discourse across political and cultural divides. Also, on February 23, CU Boulder's Center for Leadership is featuring New York Times political columnist and commentator David Brooks in a live stream event. We continue to be committed as a campus to civil discourse and the exchange of ideas, and these events are great examples of how we live out these values. With that, I'll turn it back over to Andrew for our Q&A session.
Thank you very much, Provost Moore. We want to give you all the maximum amount of time to ask your questions. If you have a question, again, please use the Q&A function at the bottom of your screen. We're going to be prioritizing questions from students and family members. We do have a couple questions that came in during those remarks, so thank you for those. We will get started with our first one. Can you please give an update on dining halls? Will there be more food options and places to social distance inside dining halls? I believe that one is a student affairs question.
Yeah, thanks, Andrew, as always. I appreciate it. JB, Dean of Students. I wanted to respond to that question. We have been working to expand opportunities for on-campus dining in a variety of ways. I think that was one of the concerns or one of the questions that students had last semester. So we really worked on including opening Sewell as an additional weekend location. We also opened Alfred Packard Grill to non-residence hall students, faculty, and staff. The Center for Community will reopen the Black Coats Grill to provide additional variety, as well as add new menu options to provide more healthy selections like acai bowls, entree salads, as well as power bowls. The menu will move to a 2-week rotation to provide more options. Finally, depending on the level of the COVID dial and what we are able to do, we will open in-person dining in the UMC and Village Center. So that's just kind of the update. Of course, if things change, then we'll change accordingly.
Apologies, I was on mute. Thank you, Dean Banks. Appreciate that. And this one probably for Provost Moore, looking at kind of a tuition question here, and more of a class schedule question. Who or what determines whether a class will be in person or not, especially since your data shows no cases of COVID-19 were from being in the classroom? So essentially, when we have these classes coming back in, what's determining whether they're in person or they're going to be remote?
Great question, and thank you for that, Andrew. What we are mindful of is, as long as we're on the COVID dial, we're bound to adhering to our masking and social distancing protocols, which limits the amount of classroom space that we have available on campus in order to keep the campus community and therefore the Boulder community as safe as possible. Consequently, the decision on how many courses would be in person was decided many weeks ago, actually, and faculty have been assigned to either in-person, hybrid, or remote teaching modalities. One of the lessons we learned from fall is that what was really upsetting to our students, faculty, and staff was the very rapid changes in modalities and protocols that we were using on campus. So our decision was to commit to about 30% of our classes being in person, about 20% being hybrid, and the remainder remote courses. And we're going to stick to that protocol. I think it'll be less disruptive to our students, faculty, and our staff.
Okay, thank you so much, Provost Moore. Another question, I believe, for Dean Banks here. Students returning for the semester have already been seen gathering in fraternity houses and in private residences on the Hill. If you're applying the lessons of the first semester, what is being done about the situation with gatherings?
Yeah, that's another great question. Thank you for that. But so some keys to this, I think, that are very important about last semester. One is that our partnerships in the community was just absolutely tremendous. Our relationship with Boulder County Public Health, CUPD, BPD, the City of Boulder, which is fantastic. Of course, we're going to continue to build on that. Anytime that we receive a report from Boulder Police Department or off-campus gatherings, about off-campus gatherings, that, if we receive a violation or anything like that, we follow up on it immediately. Our posture regarding that will not change. We still will be monitoring parties. If we get a report that any kind of large gatherings have taken place where students have attended it or hosted those parties, then we will activate our student conduct protocol, in which case may result in a suspension. So we're serious about this. We have not changed our posture there. We'll continue to build those relationships and hold students accountable accordingly.
Okay, thank you so much. Question for the provost and for COO O'Rourke. Will you host an alternative in-person commencement for the class of 2021, and for that matter, the class of 2020 at a later date, say potentially in the summer after a broader vaccine deployment?
We're currently looking at what our options are there. For so long as the COVID dial remains in effect, we know that we're going to not be able to host a traditional in-person type of commencement, and that it wouldn't accommodate us doing that at Folsom Field. What we also were doing, though, is trying to map out what we have the ability to do within that framework. And so in the upcoming weeks, we'll be providing more details around how we can celebrate our students for commencement. But we need to be in a position where I don't want to set the expectations too high that even as vaccine begins to become available, we're going to still be working within the state's COVID framework and the restrictions that are provided to us, which would limit a large gathering like the traditional commencement.
Thank you. And another question, I believe, for Pat. When does the campus expect to receive the vaccine, and how will that vaccine be distributed? Who's going to get it first?
So we have received a very limited number of doses so far, about 100. And so it is not a situation where we have hundreds and hundreds of doses to distribute, and we don't know exactly when we will get doses, and we don't know how many. What we do know, though, is that there is a prioritization protocol, and under that state classification, the first people who received those first doses were healthcare providers, because that's the way that the framework works. The next thing that we would have to be able to prioritize as additional doses come in would be the group of first responders on campus. And then we move into the population of those people who are over 70 or 70 and older who are part of our campus community. And so there are several hundred people who fall within that category, so that we won't, once we get through those populations, then we can begin to look at other people who are frontline workers, people who might otherwise also have vulnerabilities, but don't want to raise the bar too high in terms of thinking about the number of doses that we have available, because at the rate we're going, it's still going to be a significant period of time before we have our over 70 or 70 and over population vaccinated.
Thank you. Question for either Russ or Pat. Will faculty be considered educators and get vaccinated sooner, since they have to interact with students? What about frontline services workers such as facilities, staff, and RAs?
So we're currently seeking some clarification. There is that description of frontline essential workers in education, and we're in ongoing discussions with CDPHE. We do intend to be able to vaccinate our people who are interacting with students, faculty, staff in those type of frontline positions as soon as vaccine becomes available and allocated to us to be able to do it. Do want to make clear, though, that as we're doing those prioritizations, the classroom itself has, again, proven to be a safer environment than due to our social distancing, masking protocols, and the other things that we've done. So before that vaccine becomes available, don't want people to have the impression that the classroom environment has been an unsafe COVID environment, because it certainly, through our contact tracing and the work that we've done, has really demonstrated that it has been a safe environment. So we'll see how the vaccine gets allocated to us, but we'll be doing the prioritization to include those groups as soon as we can.
Thank you. And I think both Pat and Russ may have something to say on this next one. How does the timing of the vaccine affect decisions around course modality? Will courses be able to go fully online, or fully in person rather, I apologize, at some point this semester instead of being online?
I don't think that that's likely unless we have some incredibly good news and big batches of vaccine that show up and a lot of uptake of the vaccine. While we're just at the beginning of the semester, it does go fairly rapidly. It's 3.5, 4 months worth. So I would hope that we would have a large fraction of our population vaccinated in the coming months, but until we have more certainty and clarity on acquisition of the vaccine and the ability to distribute it according to our priorities, I'm not confident that not confident at all that we'll have a fully in-person modality, certainly not this semester. Pat, I don't know.
I want to follow up on that, Andrew, which is that almost all of our students, unless they have some other type of health susceptibility, probably won't be in the place where there would be vaccine distributed within that population until very late in the semester or into the summer, is the latest information that we have from CDPHE. So thinking about transitions about course modality during the course of the semester is right now knowing where the student population would be in terms of the prioritization from the state it would be very challenging to think that could occur during the course of the semester.
Thank you to both of you for that. I believe this question is geared towards the delay in in-person courses. And I believe it's probably good for Dean Banks here. How much money will the delay in starting cost the university in terms of lost revenue through reduced fees in room and board?
Yeah, I think that's a great question, and certainly leadership is assessing really the full financial impact, and we've already started to do that. We started that last semester, and that will be ongoing. Certainly a great question, but I think that's where we are. We'll be assessing to make sure that what we're doing is working for students and families. So thank you for the question.
Thank you for the answer. And another one for Dean Banks. How do you plan to handle students who ignore public health orders and have large gatherings?
Yeah, and I think I spoke to this earlier. One of the things that we're trying to do is work very closely with students to make good choices. By and large, our students have done a fantastic job with handling all the things that we've sort of thrown at them. But as I mentioned to you before, if we receive reports, we will certainly take a look at them. And if we need to move forward with holding students accountable, we're certainly not afraid to do that. Some other things that we're doing is working very closely with our Hill neighborhood. We're developing strategy with our fraternity and sorority community just to make sure that everyone is safe and understand their community responsibility. So a little bit more on the relational side is what we're working on. And certainly, again, we're not afraid to hold folks accountable, but we will certainly be working very closely with our students to make sure they understand their community responsibility.
Thank you, Dean Banks.
Following up on that real quick, Andrew.
Absolutely.
Which is, please, to the members of our community, whether it's the students or the parents, there were a number of students last year who were suspended from the university and they lost their opportunity to be able to complete their semester and to continue their work towards their degrees. That's not something that we want to do, and it's a situation where please consider that whether or not throwing that party or hosting that party is really worth the possibility that you wouldn't be able to move forward in the way that you want to and to have that type of disciplinary action taken. Our number one goal is to keep students advancing towards their degrees, to be able to continue their educational experiences. But we can't do that if people are violating public health orders and placing their peers and the community at risk. And so we're, as JB just said, we will take action where we have to, but it really starts on the front end with people making decisions that are in their own best interest and in the best interest of the community.
Thank you for that. And another one for CO O'Rourke. Will the remote start to the semester lead to any furloughs or layoffs, particularly among frontline staff, for instance, housing, dining, or bus drivers?
No, we have not been in a situation where we've had staff reductions or furloughs. We know that being able to, that were additional because of the delay of the beginning of the in-person experience for the semester. We knew that within a month after students began returning to take classes virtually, that we would have to support the in-person experience. And we want to make sure that we have our workforce in place to be able to support that as well.
Thank you. Question for Provost Moore or Katherine Eggert. If a student or faculty member doesn't feel it's safe to come back to campus, what happens? Do you have an alternative accommodation for them?
Yes, so I'll take the first cut at this answer, and thank you for the question. If a student or a faculty member, let me start with the faculty member. If a faculty member doesn't feel safe, my expectation is that they will work with their department chair to try to come up with a community accommodation to see if a colleague can take a course in person, or just to have a discussion to go over a realistic assessment of how safe our classroom environment really is. Similarly, with respect to students, I would encourage them immediately to get in touch with their advisors to make sure that they are enrolled in the kinds of courses that allow them to proceed with their academic experience in the most productive way, and if need be, perhaps trying to arrange for accommodations along the way. But again, those are the normal protocols, and to be quite honest on this one, this wasn't a huge issue in the fall once we got things well underway.
And I'll just chime in to emphasize that as of February 15th, all of our classes will be offered in the instruction mode that they were advertised as and that students registered for. So if a student is registered for an in-person class and as of February 15th does not want to come take that class in person, they should be looking for a different class because the in-person class will be offered in person. There are some hybrid courses that teach simultaneously in person and online, and students in those classes should speak with their instructors about the possibility of remaining remote if that's what the student wishes to do.
Wonderful. Thank you so much. Question for Dean Banks again. How are you creating more flexibility for students living in the dorms this spring semester? Are there any options such as open access to buildings, new eating areas, any more freedoms to move within the dorm living arrangements? The person who posed this question noted the importance to mental health there, to have some freedom of mobility.
Yeah, I definitely appreciate this question. And we've heard from our students in a number of different ways as to how some of those struggles were evident. As mentioned previously, we are adding and enhancing dining experiences. Residence hall policies will not change, but again, based on the level of the dial, we will have additional programming each week for our residents. the mental health of our students is primary, and we will continue to offer support and resources as well as engagement opportunities. And as I mentioned before, again, our students are very important. Certainly they're important to me. The mental health of our students are very important. So we're going to do all we can to meet the demand.
Absolutely. Thank you so much. Question for Pat or Jennifer McDuffie. What is your testing capacity in the spring? Is it expanded from where we were in the fall? And do we think we're going to have results available more quickly, given that we appear to be testing more people?
So I can jump in, and Jennifer, please correct me if I get any of it wrong. But we think we're going to have the ability to test 20,000 to 25,000 people per week with our surveillance testing. That we're also going to have the capacity, if necessary, to run up to 500 diagnostic tests per day. We have been scaling up, not just in terms of being able to increase the number of tests that we perform, but also to be able to do it within the same timeline expectations. So generally, if somebody does the surveillance testing, they would be tested one day, and if the test comes back positive by the next day, that would allow us to refer people over where necessary for diagnostic testing, and to be able to initiate our campus protocols for contact tracing, isolation, quarantine where necessary, and make sure that we're coordinating. So our turnaround is usually 24 hours, but oftentimes it's even less.
Wonderful. Thank you so much. Question for the Dean of Students and the Provost. Katherine, Eggert, you may want to weigh in on this one as well. Do students have to attend live classes if they're signed up for one, but they're not feeling comfortable with the COVID levels and rates as they are at that current moment, or the precautions that are being taken?
Yeah, and that's a great question. I'm going to yield to the Provost on this one. Provost, if you could jump in, and then I'll fill in the gaps.
Sure, and then I'm going to be yielding to Katherine Eggert on this a bit as well. So if a person signs up for an in-person class, the class is in person, as we indicated earlier in the presentation here. And there is no expectation that the faculty member necessarily has to provide an accommodation for a student who has signed up for that course, but then has decided that they don't want to come to the in-person class. Part of that is to try to remove some of the uncertainty that we created in the fall. Again, this is along the lines of lessons learned. We want to make sure that there is clarity and certainty with respect to the modality of courses. And if people sign up for a remote course, it's remote. And if they sign up for an in-person class, it's in person, and hybrid similarly. Katherine, if there's anything else you want to add, please do. And if you can correct me if I was wrong with any of that.
No, you're completely right, Russ. And we also want to make sure that our faculty are teaching in the mode that they themselves have are committed to. And so an instructor teaching a fully in-person class can't be expected to teach simultaneously in person and remotely if that's, if that's not how the course was designed. So we're trying to make sure that the faculty have the freedom to design their course the way that they think it will be best taught. And we're trying to make sure that students are being given what they signed up for. So it's truth in advertising for what the students registered for.
Thank you so much. Question for COO O'Rourke and possibly the Provost. So we've said campus activities are tied to the COVID dial, and I believe we're talking about the Colorado State COVID dial. This person is wondering about the specifics there. Presumably at level red, they ask, CU would return to remote education. Can we confirm that? But what if things change in Boulder, going down to level yellow or green?
So let me take on the front end first, which is that if we return to level red, then obviously we would be in a situation where we would have to look at whether or not to pause in-person instruction. The guidance that we've received from the state is that in level red, in-person instruction is discouraged and remote instruction is encouraged. It also puts us in the situation where personal gatherings become much more limited, and we don't have the latitude as a member of the community to say that we're going to operate outside of the restrictions that exist on the dial. We don't have perfect clarity right now as to what would move a county from the level orange back into level red. When Governor Polis made the announcement right around the new year that counties would be returned to level orange, it was at a period in time when many counties were, and several still are, have rates of infectivity that otherwise would have had them in level red. So we're trying to seek clarification from the state so that we could anticipate what would happen in the future. I don't want to just think about it in terms of the bad side of what happens if the infection rates go up. What I want to be thinking about also is what happens on the good side as the infection rates go down. And what we're seeing right now is that the rates of infection in Boulder County are, after having bumped up immediately after the New Year's holiday, have started to go back down, and we are at a place where the county's COVID numbers are currently in level orange, irrespective of the move that Governor Polis already made. If we got back down to level yellow in the weeks and months ahead, that means that we can have additional expanded social opportunities for students. We can think about different types of programming we can offer. And the folks who are over in student affairs are already trying to anticipate what that could mean. So that's another one of the benefits that comes if we can come back, keep the community safe, keep the numbers down, that as we head from orange to yellow to blue, we get more opportunities, and we want to be able to offer those. So everything that the student population and the rest of the community can do to help keep those numbers down means that we get closer to normal in terms of our ability to offer more programming.
Wonderful. Thank you. Provost, was there anything you wanted to add to that from a course perspective?
No, I think that sums it up nicely.
Wonderful. Thank you. Question for the student affairs side of the house, or potentially Dean Banks. As many know, the property managers in Boulder aren't always very student friendly in their terms. Students are locked into long-term and expensive leases. This makes flexibility in moving and in making important, safe decisions difficult right now. Is CU Boulder putting a plea out to local property managers to make it a little easier with lease terms during an unprecedented and challenging time?
Yeah, that's a great question, and not necessarily a plea of any sort. But one of the things I mentioned about social gatherings and all these other kinds of things and partnerships is we have had a number of conversations with property managers. So it's really opened up some really good communication. So it gives us a point of advocacy for our students, and I don't think that we've had in the past. We have several resources, such as off-campus housing and neighborhood relations, as well as student legal services to provide support to students, who are struggling with their leases. I'll also mention, we're working with Boulder Area Rental Housing Association, or BARHA, and continue to provide feedback about leasing issues, as well as working with them to deter large social gatherings.
Thank you. And I think this question is also in your lane, Dean Banks. With regard to ensuring good mental health, what is the university doing this semester to check in on students in the dorms? There were a lot of students who reported feeling isolated in the fall. Questions about, RAs checking in. What kind of processes do we have there, and what are we doing?
And again, I think that's a great question. I'm going to ask Dr. McDuffie also to weigh in on some of this as well on the mental health side. I do know our housing staff, our RAs, are all very conscious of some of those concerns. So there are pretty regular check-in. There are conversations with our RA and peer-to-peer interactions. Certainly, I've had any number of conversations with students when I do Dean on the Go. I'll get on a little cart, I'll drive around and kind of talk with students and see how they're doing. But all of our staff and residents life are committed to that. We also have additional resources on the mental health side. If Dr. McDuffie can jump in and just kind of share what happens from her lens.
Thank you so much, JB. The mental health and wellness of our students is a key priority. And so over the past 6 months, a year, we've been really investing in what that looks like in a very direct way, as well as indirectly. In the fall, we announced that the campus was able to contribute $1.8 million to our mental health professionals. And with that money, we've been able to offer embedded mental health clinicians in residence life, in academic schools and colleges, as well as expand our trainings, whether it be on stress reduction or mindfulness, or working to recognize and respond and refer for faculty and staff, as well as students around mental health. I think the other piece is we recognize that during this time of COVID, it is very normal for people to feel isolated and a sense of loss. And I think that, having the space in place in academic classrooms, we've partnered and ensured that all first year classes have mental health content and are able to provide resources and support, not only around stress and anxiety, but also around substance use and relationships. We hear oftentimes that it's hard to connect over this virtual platform. So engaging with our peer coaches who are students, but also engaging in our unlimited workshops and groups really have provided a lot of resources for our students.
Wonderful, thank you. Question for the provost or vice provost, or senior vice provost Eggert. Will the grading structure this semester include a pass-fail option?
Yes, it will include a pass-fail option, the same option that existed last fall. So what we did last year was we extended the time period during which a student has time to consider whether or not to declare a class pass-fail to the 10th Friday in the semester. So that's a significant extension over what we used to do. And that option will be available. One of the things I do have to stress, though, is that before students exercise the pass-fail option, they should contact their advisors to make sure that if they are contemplating taking a course pass-fail, that it won't hinder their ability to pursue their degree and to graduate in a timely fashion. Katherine, anything you'd like to add?
I would add that as students know, last spring when the pandemic first hit, we vastly expanded our pass-fail options, and so that a pass-fail would fulfill almost any degree requirement, any major requirement. We're not doing that again. So there are those kinds of restrictions on how many pass-fail courses you can take remain. However, students should check with their advisors. A few individual departments have made it possible to take a certain course in the major or something like that, pass-fail, just on a temporary basis. So please check with your advisor before you make any moves towards declaring pass-fail and see what the consequences would be for your degree and your educational plans.
Important to know. Thank you. Question for either Dean Banks or Jennifer McDuffie. This person has a son who lives in one of the residence halls and says his COVID testing appointment is on February 7th and doubles as his move-in appointment as well. Is that true? Is that possible?
I'll jump in first, and then Dr. McDuffie, if I'm off, please jump in, rescue me. That is correct. Students will only schedule one appointment, and that is their monitoring appointment. When students return, they will first go to the testing site for their neighborhood, then proceed to their residence hall to have room access added back to their student ID. I believe that's the way that we are moving forward. Dr. McDuffie, anything else to add to that?
No, sir. I think the only thing that I would say is if there are students who are traveling or coming from long distances or have any concerns, we do ask that if possible, they get tested within 5 days before arrival. But again, that's not a requirement.
Okay, thank you very much. Another question for JB here. Can someone's son rush, I assume they mean fraternity in the spring, and not be at risk of being suspended? Are the fraternities accepting of the new norm for spring rush?
Yeah, again, great question. Recruitment actually starts, the answer to the first question is no. We have adjusted our recruitment strategy. It is 100% virtual. So that's a good thing. We realize how important the fraternity and sorority life experience is to the student experience. So we recognize that recruitment starts around January 29th and 30th. It'll go through February 21st. So plenty of opportunities for your son to be engaged, get involved. I think fraternity and sorority life is fantastic, a great way to meet some new folks and just kind of learn a little bit more about campus. And so we're certainly going to be promoting that this spring.
Thank you. Another question for Provost Moore and Katherine Eggert. If a student gets sick during the semester, do the same rules from the fall semester apply, where students are not required to present a medical or doctor's note?
Katherine?
Yeah, I'll take that one. So that's correct. Our student health services on campus, which includes the Wardenburg Hospital, counseling and psychological services, et cetera, do not provide doctor's notes any longer. And that's a permanent decision that's will remain the same after COVID. So what we're doing is encouraging instructors not to request doctor's notes, but rather to develop, if they have an attendance policy, to develop that policy in a way that doesn't distinguish between excused and unexcused absences, and also provides flexibility if a student is out for quarantine or COVID and needs to be out for more than just one day, that their attendance policy takes that into account.
Great, thank you. And our last question for the day for Dean of Students and Student Affairs Professionals. It's currently presumed there will be no in-person family weekend festivities and homecoming again this fall. That said, if things clear up enough in the coming months, and that is quite a ways away, will that change? Is there a possibility for incoming family weekend, homecoming festivities again in the fall?
Yeah, I think that's a great question. There is some uncertainty in the air with that, but we'll continue to follow guidelines and recommendations. We're going to follow the evidence. At this time, we don't anticipate in-person programming, but we're going to continue to evaluate this. Dates are basically determined based on football and other campus schedules. So again, something that we're monitoring, something that leadership is certainly thinking about. And I know the fall may seem like it's far away, but it really isn't. It's just months away, and we're already in planning mode for that.
So that will be nailed down, to be clear, around the same time the football schedule is nailed down.
Absolutely.
Okay, thank you so much. And that was our last question. So thank you all for joining us today. If you have further questions or you'd like to see additional information, you can do so by visiting our COVID-19 website. Again, that is colorado.edu/COVID-19. Again, COVID-19 has a hyphen in between COVID-19. There's a chat at the bottom of right hand of that site where you can ask questions. CU Boulder will hold another update session on Tuesday, January 26th from 12 p.m. noon to 1 p.m. Mountain Time. That's a Tuesday. These updates will occur on a weekly basis throughout the spring semester, and our last webinar is currently scheduled for Tuesday, April 27th. We'd also like to invite you to join the Institute for Science and Policy, the Denver Museum of Nature and Science, and the Colorado School of Public Health every other week for a free webinar, each bringing a new expert perspective on the COVID-19 challenge. Their next webinar is tomorrow, Wednesday, January 20th at 8:30 a.m. It's titled A COVID-19 Conversation with Governor Jared Polis. You can find that at the Institute for Science and Policy website. That is institute.dmns.org, as in Denver Museum of Nature and Science. Again, institute.dmns.org. The City of Boulder also hosting community briefings this year every Wednesday at 3:30 p.m. BCPH's agenda for those meetings moving forward is to provide updates from the Boulder County Public Health leadership, updates from public health professionals on the current topic at hand, whether that's vaccine or testing or COVID data, and updates from local partners. We're now going to end the call. Thank you for joining.